Hi, I'm Dr. Amal Starling, a neurologist at Mayo Clinic specializing in headache disorders. In this video, we will cover the basics of migraine. What is it? Who gets it? The symptoms, the diagnosis, and most importantly, the treatment. Whether you're looking for answers for yourself or someone you love, we are here to give you the best information available. There is a lot of stigma around migraine, that it's just a headache and that it's no big deal. But migraine is a genetic, neurologic disease. It affects each person differently with a wide range of disease severity. Some have infrequent attacks, but others may have frequent, disabling attacks. Expecting someone to push through or just take your mind off of it is never good advice. Migraine is very common, affecting 1 in 5 women, 1 in 16 men, and even 1 in 11 children. Migraine attacks are 3 times more prevalent in women, likely as a result of hormonal differences. Certain genetic and environmental factors play a role in the development of migraine disease. And since it is genetic, it is hereditary, meaning if a parent has migraine, there is about a 50% chance that a child may develop migraine as well. If you have migraine, certain factors can trigger an attack. However, this does not mean that if you get a migraine attack that it's your fault or that you should feel any guilt or shame for your symptoms. Hormonal changes, specifically fluctuations in estrogen, that can occur during menstrual periods, pregnancy, and perimenopause can trigger a migraine attack. Other known triggers include certain medications, drinking alcohol, especially red wine, drinking too much caffeine, stress, sensory stimulation such as bright lights or strong smells, sleep changes, weather changes, skipping meals, or even certain foods like aged cheeses and processed foods. The most common symptom of migraine is the intense, throbbing head pain. This pain can be so severe that it interferes with your day-to-day activities. It can also be accompanied by nausea and vomiting, as well as sensitivity to light and sound. However, a migraine can look very different from one person to another. Some people may get prodrome symptoms at the beginning of a migraine attack. These can be subtle warnings such as constipation, mood changes, food cravings, neck stiffness, increased urination, or even frequent yawning. At the end of a migraine attack, you might feel drained, confused, or washed out for up to a day. This is called the postdrome phase. Because there is such a wide spectrum of disease severity with migraine, there is also a wide spectrum of management plans. Some people need what we call an acute or a rescue treatment for infrequent migraine attacks, whereas other people need both an acute and a preventive treatment plan.